Do you struggle with managing your allergic rhinitis like this poor girl? Do you find yourself sneezing, constantly blowing your nose, or rubbing at your itchy, watery eyes? Or maybe you have asthma and you're looking for medicine to manage it, along with your flare-ups from exercising. Then what you need is Montelukast. Montelukast is a leukotriene antagonist used in the prevention and chronic treatment of asthma, exercise-induced bronchoconstriction in patients 6 years and older, and the management of seasonal allergic rhinitis, also known as hay fever. Montelukast works by inhibiting these inflammatory molecules in our bodies called leukotrienes. Leukotrienes cause airway swelling, constriction, and altered cellular activity. So, if these leukotrienes are inhibited and stopped from working properly, then none of these things should occur. Most people automatically think of inhalers when talking about the treatment for asthma. However, Montelukast is just a pill that you take once a day. They even have chewable tablets for children that are prescribed Montelukast. If you're taking it for asthma, you want to take it in the evening, but if you're taking it for allergic rhinitis, you can take it any time of day, whether in the morning or at night. And if you're taking it for exercise-induced bronchoconstriction, which is just like an asthma attack that occurs when you're trying to exercise, you want to take it about 2 hours before exercising. So if you do decide to give Montelukast a try, there's a few things you'll need to keep in mind. Be sure to take this medicine as prescribed by your doctor. If you're taking it for the exercise-induced asthma, be sure to take it those 2 hours before exercising, because this aids in the prevention of that bronchoconstriction. And do not discontinue any of your other asthma medications without talking to your doctor first, because you are most likely left on those other asthma meds for a good reason. Now, there are some adverse effects that can arise with taking Montelukast. Some of these include suicidal thoughts, anxiety, headache, feeling tired or even difficulty sleeping, sleepwalking, nosebleeds, sinus or ear infections, a cough, abdominal pain, diarrhea, Stevens-Johnson syndrome, which is a rare, serious disorder of the skin and mucous membranes involving a painful rash and blistering of the skin, fever, and increased liver enzymes. So be sure to tell all of your doctors, if you haven't already, that you are taking Montelukast. And one of the most important things to remember with taking Montelukast is that it should not be used for asthma attacks. Montelukast is used for the long-term management of asthma, more so to alleviate the symptoms. If you do experience an asthma attack, you'll need to use your SABA inhaler as prescribed by your doctor. And if you do have a hypersensitivity to Montelukast, you should not take it, as this can lead to life-threatening situations. And Montelukast should be used cautiously in those who suffer from acute asthma attacks, phenylketonuria, a birth defect that causes a buildup of phenylalanine in the body, liver impairment, reduction of corticosteroid therapy, or if they're pregnant or breastfeeding. And finally, once you've started taking Montelukast, how would you know if it's actually working? You should be experiencing a reduction or cessation in symptoms of asthma, a decrease in the severity of your allergic rhinitis, so your nose shouldn't be running as much, you shouldn't be sneezing as much, and your eyes shouldn't be as itchy and watery, and a prevention of exercise-induced bronchoconstriction, so you'll actually be able to breathe while you're exercising. Remember the suffering girl at the beginning of the video? Well, this is her now, after taking Montelukast for a week, finally being able to enjoy quality time with her cat without having to worry about her allergic rhinitis.